Have you ever opened a lab report and felt your stomach drop at a scary number, only to learn later it wasn't your body that was off? It was the timing, the breakfast, the supplements, or even yesterday's workout? I've seen it too many times to count. A healthy person flagged for liver trouble, a false alarm for diabetes, a cholesterol panic, all because of simple preparation mistakes in the 24 to 48 hours before the blood draw. Here's the twist most people don't know. Your blood is a living snapshot, and tiny choices can tilt that snapshot dramatically. Even healthy habits like exercise or a morning coffee can send your results zigzagging. And yes, there's one common prep mistake that trips up the vast majority of adults and can swing cholesterol by a quarter or more. If you're 50 or better, or you care for someone who is, stick with me. You'll walk away with a straightforward plan that protects you from misdiagnosis, avoids unnecessary medications, and saves you repeat testing. We'll close the loops, I promise, and by the end, you'll know exactly what to do the day before, the morning of, and the moment you sit in that chair. Let's start with one of the most overlooked pitfalls: medications and supplements. Many everyday products shape lab values in ways that don't reflect your true health. That hair and nail supplement with biotin, for example, can confuse certain lab methods and produce falsely high or low results for thyroid hormones, vitamin levels, and even heart-related markers. High-dose biotin is a well-known culprit, but it's not alone. Vitamin C can tinker with glucose and certain lipids. Aspirin and some anti-inflammatories influence platelet behavior. Decongestants may nudge blood pressure. Iron and B vitamins shift nutrient panels. Even natural blends can contain substances that alter enzymes. The safest move is simple. Make a complete list: prescriptions, over-the-counter, vitamins, herbs, and as-needed items. Share it with your clinician before the test is ordered. Do not stop prescribed medications without medical guidance, but do ask about timing. Some non-essential supplements are best paused for a day or two beforehand, especially biotin. If a medication could affect interpretation, your clinician can plan the draw strategically or account for it when reading your report. Your body dances to a 24-hour rhythm, and some lab values swing widely based on the clock. Cortisol, for instance, peaks in the morning and drifts lower by night. If you test late afternoon, a naturally lower cortisol might look concerning, even when your adrenal function is perfectly fine. Testosterone in men trends higher early in the day and wanes later, so afternoon testing can make levels appear low. Iron runs higher in the morning. White blood cells can creep up as the day goes on. Even lipids and glucose have diurnal patterns influenced by meals, sleep, and hormones. What does this mean for you? If you're tracking a marker over time, keep the collection time consistent. Same window, same lab, if possible. Morning draws between roughly 7 and 10 are often ideal because many reference ranges and clinical decisions assume that timing. For hormone testing, cortisol, testosterone, morning is especially important. If you can't get a morning slot, do 2 things. Note the collection time on your copy of the results and make sure your clinician sees it. A number is never just a number without context, and time of day is big context. Now, let's talk about movement, the kind that keeps your heart strong but can trick your labs if the timing is off. Vigorous exercise can raise muscle-related enzymes for a day or two, sometimes longer after a grueling session. It can also transiently alter liver enzymes, white blood cells, and inflammatory markers. Even a moderate run the morning of your test can shift results enough to spark worry or prompt repeat testing. If a panel includes muscle enzymes, inflammation markers, or liver function tests, the safest course is to skip intense workouts for 48 hours. And if you've trained especially hard, think long endurance or heavy lifting, give it 72. Light walking is fine. In fact, gentle movement can help you relax and keep veins easy to access. But save the sweaty intervals, hill climbs, and personal best deadlifts for after the needle comes out. If you're an athlete or you simply love your morning gym ritual, flag your recent activity to your clinician. A quick note like lifted heavy 2 days ago or long hike yesterday can prevent overreactions and unnecessary follow-up. Alcohol is another stealthy shapeshifter. Even moderate intake in the day or two before your draw can nudge triglycerides upward, blur liver test accuracy, and muddy glucose regulation. Heavy drinking? The ripple effects can linger for days in certain markers, with enzyme elevations that may trigger extra imaging or repeat labs. The liver prioritizes processing alcohol, temporarily disrupting its usual jobs, like handling fats and sugars, and those shifts show up on paper. Alcohol also affects platelets and clotting factors, which can mislead interpretation around bleeding and clotting risks. What's a prudent window? For most people, avoiding alcohol for at least 48 to 72 hours before testing is a wise baseline, and if you're getting a detailed metabolic or liver panel, consider a full week. That includes wine, beer, spirits, and yes, some liquid medications that contain alcohol. If you happen to partake closer to the test, don't panic. Just tell your clinician. It's much better to interpret a slightly off value with honest context than to chase a phantom diagnosis. Hydration is one of the simplest levers you control and one of the most misunderstood. When you're dehydrated, your blood becomes more concentrated. That can push kidney markers, sodium, potassium, and blood counts higher than they truly are. And suddenly a normal body looks suspicious for kidney strain or a blood disorder. Swing to the other extreme and chug a giant bottle right before your appointment, and you risk diluting sodium and other values, creating an equally distorted picture. The sweet spot is boringly consistent. Drink your usual water through the day prior and the morning of, and avoid big last-minute gulps. Pale yellow urine is a practical check. Too dark suggests you're behind. Crystal clear might mean you overdid it. Most adults do well sipping 16 to 24 ounces across the 2 hours before testing, especially if fasting. Coffee and tea can be dehydrating for some, so keep them modest and skip alcohol beforehand for multiple reasons. If you're fasting, plain water is not only allowed in most cases. It helps your veins cooperate and your results reflect reality. Stress doesn't just raise blood pressure in the clinic. The white coat effect can alter several lab values in the short term. Elevated stress hormones can bump glucose, mobilize white blood cells, and temporarily raise inflammatory markers. If needles make you queasy or medical settings speed your pulse, you're not alone, and you're not powerless. Build a buffer before your draw. Arrive 15 to 20 minutes early and give your nervous system a soft landing. Slow your breath. 4 seconds in through the nose, a gentle 6 to 8 seconds out, and do a few rounds. If music soothes you, bring calm tracks and a pair of headphones. Tell the phlebotomist if you're anxious. A skilled one will adjust their approach, talk you through, and may offer a lying down position if you're prone to lightheadedness. Choose a morning appointment if your worry tends to build with the day. These small tweaks can keep stress from masquerading as illness on your report, and they make the whole experience kinder to your body and mind. Here's a quiet variable that few people think about: posture and movement right before the draw. Standing, walking briskly, or even repeatedly clenching your fist can shift certain results. When you stand, gravity pulls fluid into the tissues, concentrating what remains in the bloodstream. A quick hallway power walk, then hopping right into the chair, can make proteins, cholesterol, and blood counts appear higher than they would after a brief rest. Potassium has a special quirk. Aggressive fist pumping can cause a short-lived spike, occasionally dramatic enough to look dangerous when your heart is perfectly fine. Best practice is simple. Aim to sit quietly for at least 10 to 15 minutes before the needle goes in. Keep the arm relaxed and supported at about heart level, and avoid pumping unless your phlebotomist specifically directs a gentle squeeze or two to find the vein. If you had to trek across a large hospital or up a few flights of stairs, add an extra few minutes to settle. Stillness may be the least glamorous tip here, but it buys you cleaner, more trustworthy numbers. Now let's look at something crucial. If you've had medical procedures or IV fluids, which arm is chosen? If one arm has an IV, recent injections, a vaccination site, or contrast dye from imaging, drawing from that side can contaminate the sample or reflect a very local reaction rather than your overall status. For example, fluids with dextrose from an IV can falsely elevate glucose if they seep into the sample site. Recent shots can spike inflammatory markers in that limb. Repeated blood pressure cuff use on one arm can temporarily change readings too. If you've had lymph nodes removed under one arm, often after breast cancer treatment, avoid blood draws and blood pressure cuffs on that side to protect against lymphedema. Here's your move. Before anyone ties the tourniquet, speak up. Mention IVs, vaccines, injections, or procedures from the past day or two, and which armpit, if any, had lymph nodes removed. Most phlebotomists will happily switch arms. If both arms are off limits temporarily, it's okay to ask whether the draw can wait or be done at an alternative site. Food choices in the 24 hours before testing can tilt a surprising number of values. A rich, high-fat dinner can push triglycerides up the next day and turn the serum milky, which sometimes interferes with other measurements. A large portion of red meat the night before can make kidney function look worse than it is by nudging certain breakdown products higher. Sugary snacks and late-night desserts can elevate next morning glucose, even if you're technically fasting. Artificial sweeteners and caffeinated drinks also tug at hormones and sugar handling in ways that show up on paper. The fix is practical. The day before, keep meals balanced and light. Lean protein, vegetables, whole grains, and healthy fats in modest amounts. Skip the fried foods, heavy sauces, and late-night sugary treats. If your panel includes cholesterol and triglycerides, some clinicians prefer you to eat your usual pattern for a couple of weeks before the test to get an honest baseline. Then avoid high-fat meals for the final 24 hours. Jot down what you ate the day prior. If something looks off, that record helps everyone interpret wisely. If this is helpful, take a second to subscribe to Senior Vitality Pro and tell me your age or where you're watching from in the comments. I read them and shape future topics around your needs. It genuinely helps me tailor this channel to you. The most argued over topic deserves clarity: fasting. True fasting for lab work generally means no calories, no food, no creamers, no juices, no flavored drinks. Plain water is typically encouraged, and in many panels, black coffee or unsweetened tea is still considered something because caffeine and trace compounds can influence certain values. The tiny things count more than people realize. Breath mints, gum, even a few sips of a sports drink can register. Oil-based supplements like fish oil and high-dose vitamins can also shift results. Aiming for a clean 10 to 12 hours is a sweet spot for many standard tests. Longer fasts can backfire by nudging the body into stress chemistry that alters glucose and some fats. Schedule your draw early, cut off eating the night before, and keep water handy. If you take medications in the morning, ask your clinician whether to take them with a small sip of water or wait until after. And if you accidentally break the fast, even just a bite, it's better to be honest and reschedule than to pay for numbers that don't reflect you. Let me pull this together into a simple, realistic plan you can follow without guesswork. The day before your test, eat as you normally do if your clinician wants a baseline, but keep the last 24 hours on the lighter, balanced side. Grilled fish or chicken, beans or tofu, steamed or roasted vegetables, a modest portion of whole grains, and simple seasonings. Skip the fried foods, heavy cream sauces, large steaks, and late-night desserts. Avoid alcohol for at least 2 to 3 days if possible, and certainly for the final 48 hours. Keep caffeine moderate. Drink your usual water. Aim for that pale, straw-colored urine. Avoid unusually intense workouts for 48 hours. Choose an easy walk instead. Gather your medication and supplement list. Circle any non-essential items like biotin and ask your clinician about pausing them. Set a reminder for when to start fasting. Aim for 10 to 12 hours before the draw. And place a snack in your bag for afterward, such as yogurt with fruit or a small sandwich, so you can gently refuel. On the morning of your test, keep it calm and consistent. No breakfast if you're fasting, and skip the cream or sweeteners in coffee. Ideally, skip the coffee entirely to avoid last-minute hormone and glucose shifts. Drink plain water in sips, enough to keep veins friendly, not so much that you dilute values. Arrive early to allow 10 to 15 minutes of quiet sitting before the draw. If you had to hustle to the lab, add 5 more minutes to settle. Breathe slowly, soften your shoulders, and let your jaw unclench. Tell the phlebotomist about recent exercise, medications, supplements, injections, or IVs. Ask to keep the arms supported at heart level and avoid fist pumping unless instructed. If you're nervous, mention it. You can request to lie down. After the draw, enjoy that packed snack and rehydrate. If anything interfered, poor sleep, a cold, a stressful event, note it for your clinician. Those details, combined with smart prep, make your results far more meaningful. Special situations deserve a quick word. If you live with diabetes, low blood sugar risk always outweighs a purely clean fasting window. Work with your clinician on a safe plan for medication timing and fasting duration. Some tests can be adjusted, and no lab is worth a dangerous dip. If you take blood thinners or antiplatelets, never stop without explicit medical advice. If you've had recent infections, vaccinations, dental work, or procedures, let your clinician know. Many of these elevate inflammatory markers temporarily. If you've had breast surgery with lymph node removal, protect that arm from sticks and cuffs. If you supplement iron or B12, timing can shape those labs. Ask whether to pause for a day or two. For thyroid testing, avoiding high-dose biotin beforehand is particularly helpful. And if mobility or transportation complicates timing, schedule on a day when you can rest before the draw. These aren't nice-to-haves. They're the difference between clarity and confusion. Let's zoom out to a principle that matters just as much as single results: consistency over time. Clinicians don't merely look at one number. We watch patterns. When you keep your pre-test routine consistent, same time of day, similar meals the day before, similar hydration, same exercise window, your trend line becomes trustworthy. That's how we tell if a change is your body or just a different breakfast. If possible, use the same lab each time. Different laboratories use different equipment and reference ranges, which introduces subtle variability. If you must change labs or times, make a note. And if a result is surprising, too good or too scary, repeat it under ideal conditions before changing medications or chasing a diagnosis. I can't tell you how often a crisis disappears on the second draw when the prep was careful and the timing was right. You deserve accuracy before action. Here's a quick memory guide to help it stick. Think of the word calm test. C is for clock. Book morning, keep timing consistent. A is for alcohol. Avoid for 2 to 3 days, especially for liver and lipid panels. L is for level with your clinician. Complete list of meds and supplements, including biotin and fish oil. M is for move lightly. No intense workouts 48 to 72 hours before. T is for thirst. Hydrate normally. Don't chug. E is for eat wisely. Balanced meals the day before. Skip heavy fats and late sugar. S is for stillness. Sit quietly 10 to 15 minutes before the draw. Arms supported, no fist pumping. T is for the right arm. Avoid the side with IVs, injections, or lymph node removal. Post it on your fridge or keep it in your phone. When you pair Calm Test with the simple day-before plan we mapped out, you're covering the big levers that move most lab results. Another underrated tactic: annotate your life on test day. If you slept poorly, fought a cold, took an unusual dose of medication, or had an extra stressful morning, write that down and share it. Mild illness and stress can elevate white blood cells and inflammation markers. Lack of sleep can tweak glucose and cortisol. Even seasonal allergies influence certain labs. These aren't excuses, they're explanations that prevent rabbit holes. If a result doesn't fit your symptoms or history, it's reasonable to ask for a confirmatory test, ideally under the more controlled prep you now know how to do. And remember, one odd result rarely defines your health. It's the repeated, well-prepared measures that carry the most weight. If something truly is shifting in your body, clear, consistent testing will reveal it without confusion from pizza, panic, or push-ups. Let's talk about when to reschedule. If you accidentally broke your fast, chewed gum, took an oil-based supplement, added a splash of cream, postponing is smarter than pressing on. If you have a fever, a stomach bug, or just finished a brutal workout, give your body a day or two to normalize unless the test is urgent. If you had alcohol the night before and your panel includes triglycerides or liver tests, rescheduling helps avoid false alarms. And if the phlebotomist can only access the arm with a fresh injection or IV, ask kindly whether a different site or another day is better. You're not being difficult. You're protecting the accuracy you and your clinician rely on to make decisions. A quick pause now can save you a cascade of imaging, medications, or worry later. Caregivers, this is your cue. If you're supporting a parent, partner, or friend, your calm planning makes their results cleaner and the experience kinder. Help set the fasting start time and place a cheerful note on the fridge. Prepare a simple dinner the night before, light, familiar, and tasty. Pack water and a post-draw snack. Bring the medication and supplement list, including the occasional ones. When you arrive at the lab, advocate for a few minutes of quiet sitting before the draw. Mention prior surgeries, lymph node removal, or recent shots. If anxiety is high, ask for a chair that reclines or a private room. These gentle nudges are powerful. They spare your loved one unnecessary repeat tests and help clinicians see the truest version of their health. You might be wondering, what about my morning coffee? Here's the nuanced answer. For many fasting panels, plain water is best. Black coffee can still influence certain markers in sensitive individuals, especially glucose and cortisol, and some labs prefer you avoid it. If you and your clinician decide black coffee is okay for your specific test, keep it small and consistent. No creamers, no sweeteners, not even just one drop. Herbal tea without additives typically behaves like water, but flavored teas sometimes contain oils or sweeteners. When in doubt, water wins. Another common question, do I have to fast for cholesterol? Practices vary. Non-fasting lipids are often adequate for routine checks, but triglycerides are especially sensitive to recent meals. If you're monitoring changes or troubleshooting high triglycerides, fasting may be advised. Ask what your clinician prefers for your situation, and then follow that plan the same way each time. Let's close the loop on the big idea. Your blood test is not an exam you pass or fail. It's a snapshot, useful only if the camera is steady, the lighting is right, and you're not moving. The choices you make in the day or two before the draw are the tripod: timing, food, movement, alcohol, hydration, stress, stillness, and the right arm. When you respect those levers, the numbers reflect you, not a momentary distortion. That means fewer scares, smarter treatments, cleaner trend lines, and more confidence in your care. It also means you won't be sidelined by a preventable false alarm that sends you to specialists, scans, and worry you never needed. This is practical power you can use every time your clinician orders labs. Before you head to your next appointment, take 60 seconds and sketch your plan. Morning draw, balanced meals the day before, no alcohol for 2 to 3 days, light movement, steady water, 10 to 12 hours of true fasting if required, calm arrival, stillness before the draw, and the right arm chosen thoughtfully. Put calm test in your notes. If something unexpected shows up on the report, Remember what you've learned here and ask for a repeat under ideal conditions. You are not at the mercy of mysterious numbers. With a bit of preparation, you make those numbers work for you. And now I'd love to hear from you. Have you ever had a scary result that turned out to be nothing after a repeat? Which prep tweak surprised you most today? Your stories help others feel less alone, and they help me keep this channel precisely tuned to what you need.